9 times I had surgery, and 9 times I was prescribed opioids. And 9 times I never had a discussion with a doctor in advance about what my pain experience might be and what my options might be.
Post-surgery, it does make sense perhaps to have a short script of opioids, but then that absolutely does need to be done in combination with the range of therapies from exercise to acupuncture, massage, yoga, cognitive behavioral therapy, a full range of treatment options. I think the evidence base is continuing to build out, but the goal should be to improve pain, function, and quality of life. That's really what we're aiming for. And if, I think the physical therapy community is well poised to help deliver on that.
What CDC has done in prescribing guidelines is a great first step. It's multifaceted, it's across all areas, and coming together as a country, not blaming the addict, the pharmaceutical, but coming together to address this is the only way we're going to be able to defeat this.
The understanding needs to be that that's not the first choice, that we have physical therapy, exercise, we have non-opioid medications, antidepressants, sleep medications. I mean, the patients have such complex stories and complex needs. We're not going to solve this with one pill or one type of pill. I think a lot of it is really giving people more tools to manage their pain. I think it's a mistake to think of this as just an opioid. I always think the opioid itself is a marker that they didn't have comprehensive care.
When you're telling a patient who's taking opioids and has pain to stop taking the pain medicine, it is totally counterintuitive for that patient. So I think it's really about sitting down and having a very earnest conversation with them. You have to build trust, and you have to build credibility. The truth is that most people don't feel great on opioids. So if you're offering them something else, most people really want another option.
I often say that this issue is a NIMBY issue for employers. It's the not in my backyard issue. And it's not because they don't know that this is a problem. I mean, everybody reads the newspaper, but it's a challenging issue for employers to identify because they're not clinicians. The CDC guidelines are fabulous. Unfortunately, they're not being implemented. And so, these are some real actionable, concrete areas where employers can have meaningful impact by working with their vendors.
If someone hasn't had multiple surgeries and doesn't have a disease process that causes pain, they still have pain when they're coming off of opiates. They have muscle cramping, they have belly pain, they have nausea. They're uncomfortable, and they need a team of people to help them get through that and realize this pain is manageable. It really does work. And people that never thought, I can live without opiates, they just thought they would be on opiates the rest of their lives, are opiate-free and doing well. They may not be pain-free, but it's very manageable, and they're more active and functional than they've been in years.
There's just a wonderful opportunity for communication and for patients to be educated in advance about pain and about their choices, and not just given a prescription for opioids. I managed my opioids pretty well. I was very conscious of it and determined to be extremely cautious, but opioids don't help you recover. They don't help you get your range of motion back. They don't help you make the progress that you need to make to get your strength back and return to your life.